All right, welcome back to our final segment of the January 2016 County Connection Show. I'm taking up more time just doing all the intros.
Yeah.
And so thanks for sticking around. If you've seen segments 1 through 4 already,
That's really bored.
That's impressive.
Clearly,
there's
your clicker is broken.
Yeah, something happened. You've fallen and can't get up. And the TV is up. All right, I'm going to hear about that one. All right, Thomas, you want to talk about a recent change to our county's benefit and some personnel policies?
Yeah, so this is something that the commissioners discussed just about a year ago and told Molly, our HR manager, to start working. HR director. To start working on, and that is adding to our health benefits plans coverage for trans employees and their dependents, and then changing our HR policies so that Summit County government is a safe and supportive workplace for somebody that's trans to go through transition and get the health services that they need. And so I think that the important thing to understand is that both the AMA, the American Medical Association, as well as the APA, the American Psychiatric Association, took a position here about 4 or 5 years ago that both of these policies are very appropriate with regards to people that are transgender. And so we had Molly doing this research the last year. It was a lot of work with regards to working with our health insurance providers, and then the appropriate work on the HR policies manual to provide these services. And we approved that here at the end of 2015. These provisions go into effect January 1 of 2016. And so I serve on the state board of One Colorado, which is an advocacy group for LGBT issues in the state of Colorado. And they were instrumental in helping Molly with regards to putting all of these policies together. And I'm very proud of all three of us for our decision to do this and to provide these services. I feel like in the 21st century, that's going to be part of what a good employer does with regards to the transgender population and those employees and their dependents.
And there are a number of large organizations, large employers that have taken a similar approach. We are somewhat on the leading edge within governmental entities within the state of Colorado. And so again, I think be very proud of taking that step forward, and I expect that there will be a number of other entities that step up and take a similar approach going forward.
Yeah, some very large businesses did this a while ago, so in some ways we're not the leading edge here, but it is unfamiliar territory for a lot of people. And it really comes down to the fact that we were being discriminatory previously. And the other thing that comes up, people think, well, that must cost a lot of money. But when we looked at it, we were surprised that the cost is very minimal. It may be counseling, it may be hormonal therapy, it could be surgery, but all of those, the most that you could spend is something along the lines of maybe an ACL replacement that we see a lot of here. So it's not what people think is some outrageous sum of money.
Yeah, I think one of the things that's important to understand is, in addition to providing the actual medical services, it's providing a safe and supportive working environment. And so the HR policy manual stating how a person will be respected and treated if they decide to transition in the workplace is just as important as providing the medical benefits that the plan will provide. So anyway, it's good stuff. And you're right, there are lots and lots and lots of private companies that already provide this in their health insurance coverage and have similar statements. I think that we're early in terms of local governments in Colorado that are providing this service, but a lot more I predict will follow.
And so, Thomas, you mentioned that you serve on the One Colorado board, which segues into our next topic, which is just talking a little bit about the different boards and commissions the different activities that you guys have as county commissioners. And so, Dan, why don't you start with some of the groups that you, whose boards you sit on, the types of activities, how you divvy it up?
Yeah. Well, first of all, I think it's important to note that we're all 3 county commissioners. We all represent all of Summit County, but we don't go to every single meeting, and we try to do our best to be very strategic in terms of me not going to every water meeting that Karn goes to, or me not going to every human services meeting that Thomas is involved with. So my area that kind of a specialty, well, we're all involved with Colorado Counties Incorporated. That's more or less a trade group where the majority of the counties in Colorado are members of. And so we have different legislative meetings down in Denver, and actually they start up right at the end of the month, where fairly frequently I'll be down in Denver on Thursdays and Fridays, and we'll have all different types of subjects that we'll be looking through the lens of really what a particular bill at the state capitol would mean towards local government and counties. So I'm involved with CCI, I-70 Coalition Board, Summit County Cooperative Extension, Summit Medical Center Board, Summit Stage, Wildfire Council. I'm on a couple different statewide wildfire advisory groups like Emergency Fire Fund, as well as the Colorado Division of Fire Prevention and Control. So those are a few areas that I'm kind of like the designated person for, but we're also involved with a lot of different other topics. So, Karn or Thomas, you want to share some of your areas?
Yeah, so one of my big areas is health and human services. It's interesting, Colorado is one of a few states where health and human services are actually provided at a county by county level with regards to the oversight and employment of the people that do things like child welfare and social services and public health. You go to a lot of other states, and those people providing those services are actually employees of the state. But in Colorado, all of those employees are employed by the various different counties. And so I'm fairly involved with regards to a lot of those different services. Most notably, I serve on the State Board of Human Services for the state of Colorado, which is a rulemaking board that writes all of the rules to implement all of the laws passed with regards to things like child welfare and social services and child care centers and everything else like that. So HH&S stuff is a big thing for county commissioners in Colorado, and the 3 of us, I'm the one that's involved in that. Also very involved with regards to the Housing Authority. I'm the county's representative to the Multi-Jurisdictional Housing Authority and also serve as its chair. Also very involved with regards to childcare issues. And so I'm the county's rep to Early Childhood Options, which is the umbrella nonprofit here in Summit County that oversees all of the different things with regards to childcare, both home and center care. Your turn.
So yeah, we go through this process. It's our first resolution every year, and some of these organizations require that we pass a resolution saying that we are the representative. Some of it is more internal, that we decide we want to have one of us, not 3 of us, going to some of these meetings. So I have a whole long list of water groups. Colorado Basin Roundtable, representing the Colorado Basin, and then the Summit Water Quality Committee, that's local to water quality in Summit County, and Water Quality and Quantity Committee, that is a larger regional effort, started long before these other groups by our friend Tom.
Right.
When there was a realization that we needed to be more organized. So Tom Glass was passing the hat to try to get people to give a little money to QQ, Water Quality and Quantity Committee. So it's a West Slope, mostly headwaters group of people that pay attention to the bills that may be impacting us that are related to water. I sit on the Northwest Colorado Council of Governments board that oversees about 9 different programs that are all grants from the state or federal government, supporting programs, again, regionally. So the whole northwestern Colorado region gets benefits from all those programs. And there are a few more.
Workforce.
Oh, workforce, that's another one. That
Arts.
is
Weeds.
Noxious Weed Advisory Council that
Not
these guys
marijuana.
tease me about. Yeah, not marijuana, but the other noxious, or the noxious weed.
So bad weeds as opposed to good weeds.
Right. Marijuana is not on the state noxious weed list. So we don't have to eradicate it unless there are other issues, but they're not considered noxious in terms of taking over. So lots of variety, lots of fun. Many of these do have state or federal legislation stating there will be a county commissioner on this board, with the idea that otherwise you don't have that local or rural voice. So it makes sense, but it does end up meaning a lot of meetings and boards for all of us.
Yeah, and I will say, certainly, I've been at the county for a long time, and I would say that the three of you are extremely involved, whether it's at the state level, the regional level, or the local level, with a wide variety of commissions and boards, and that you guys are very active in all of those groups. You're not just there for the free lunch or the breakfast or whatever.
You're there. Good.
You're there for the action associated with the meeting. And so again, commend all of you for the amount of time and dedication that you have put towards all of those things.
Yeah.
And with that said, we've gone way over on this segment. And so I'm hoping that our fact checker stopped watching a while ago, and I won't have to hear from her.
Yeah.
All right. See you, Julie. All right. So with that said, thanks for joining us. Thanks for sticking around for the whole show, and we'll be back in a month or so.
Happy New Year.
Yeah. Get out and ski.